Hi, my name is Gabrielle Entile with Drug Topics, and today we're speaking with Mike Johnston, Certified Pharmacy Technician and founder and CEO of the National Pharmacy Technician Association. We're talking about how the effects of COVID-19 have had on pharmacists, particularly on the safety and defenses against the virus. Thanks so much for joining me today.
Thanks for having me.
Report also showed that most types of pharmacies, notwithstanding the retail chain, mass and grocery, have minimized direct contact with patients, but a majority of these pharmacies also reported that their pharmacy hasn't limited the number of employees interacting with each other. So how can pharmacies simultaneously limit the contact while also addressing this huge influx in need and influx in patients as well?
So the FIP's recommendation with this was that you limit the number of staff that are interacting with the patients, and that you keep those staff members kind of stationed there. So instead of having, technicians and pharmacists switching out at the cash register throughout their shifts, it really should be one designated employee per shift that's handling those interactions. And then the second recommendation that was made is to, as much as possible, to split up your staff into teams or shifts that work together for their work week, and that you keep them separated, and actually, even if possible, shut the pharmacy down for a brief period between shifts, so that way there's no cross exposure between them. That also would be an opportune time to do some cleaning and disinfecting in the pharmacies.
And what can we expect to see if these same sort of trends continue? I know you said some things have improved, but if we don't see significant improvement, what can we expect?
I think we are looking at significant exposure that's not necessary. To be blunt, that leads to potential exposure of liability with employers. And I think there's going to be significant ramifications afterwards of pharmacists and technicians that assess a situation and have a different look at their employer and how much they're truly valued, and whether or not they want to continue a employment relationship with that organization. So I think there's some really serious implications here. And again, there's a lot of employers that are doing the right thing, that have really stepped up for their pharmacists and their technicians, that have put their well-being ahead of profit and other business matters. And I think they're going to come out the winners in the end of all this.
And to go along a more positive note, what was some of the more promising data that the NPTA found in its survey?
So overall, we were very impressed and felt that it was promising to see what was happening at the independent retail pharmacies and health system pharmacies. And I think the other positive outcome is looking at what's happened over the last 2 weeks and seeing that there have been significant improvements and changes that have come. So, certainly we would have liked to see these implementations made earlier, but across the board, including the chain retail pharmacies, they do appear to have implemented a lot of the recommendations. They are involving PPE, and they've installed plexiglass, and most locations now. There's still some chain pharmacies that are not doing this, which now they're going against CDC recommendations and guidelines too. But overall, I think the majority of organizations have been made aware of the data and have taken a look at that and made the improvements that they can. So if the survey data and exposure of this has made a positive outcome in any way, then we feel like we've we've accomplished something important with this.
And then there was also a report from the NCPA, the National Community Pharmacists Association, that nearly 90% of community pharmacists have experienced some sort of drug shortage since the outbreak began. Have pharmacies in general been seeing shortages in PPE and other protective equipment as well, or should they expect to experience these supply shortages?
Yes, so that has been a significant issue with the PPE of just being an overall shortage of it, and needing to reserve as much of that as possible for the highest risk situations going on in healthcare right now. And so and a lot of employers may point to that and say, well, we couldn't do it because there was a shortage, there wasn't capacity. And in those situations, I push back though and say, okay, but if that was truly the case, why were you prohibiting your employees from bringing their own supply in? So everything doesn't line up there. There certainly is still a shortage going on, and so you've got situations where they may have to be using cloth masks and things of that nature. But I don't think that we're going to see a huge influx of supply anytime soon. So it is going to be an issue that needs to be watched.
And then finally, in the NPTA press release, you called on all state boards of pharmacy and other regulatory agencies to immediately require pharmacies to take the necessary actions to protect their pharmacists. Ideally, what specific actions does the NPTA want to see and from whom?
I think the easiest way to do it is simply in following and implementing the guidelines established by FIP on the recommendations to safeguard the pharmacy workforce. So we've already got documentation and internationally agreed upon guidelines and recommendations. And so I think that's probably the easiest step in getting that put out there.
So Dr. Johnston, thank you so much for taking the time to discuss this super important topic. I really appreciate your time, and stay well.
All right, you too. Thank you.